Thank you for joining us. My name is Yael Cass, and I'm a Senior Leadership Executive for School Operations and Facility Management at ISS. This is the third webinar in a series of webinars on school operation, which we will continue broadcasting in the weeks ahead. These webinars are offered to enhance the ability of school leaders and school operations staff to apply their efforts as efficiently and effectively as possible during these unprecedented times, and to be prepared as much as possible for the unknown future. We received a great number of questions from you today, all valid and equally important. We will do our best to cover as many topics as possible in the 1 hour we have. This is the second webinar dealing with back-to-school practices and practicalities. We hope you will gain some insights and take some good advice to go about your school reopening. Next week's webinar will deal with legal liability and risk management regarding this pandemic. This webinar will help identify the most significant liability factors from a legal perspective and present risk reduction strategies. Panelists will include a lawyer, a compliance officer, and an insurance executive. So let's get started with some practicalities. Please keep your microphones muted. We encourage you to share resources and ideas in the chat. Dana Watts from ISS will post in the chat area some resources and articles that we collected. The link for the recorded webinar will be sent to participants and posted in the ISS website and YouTube, along with the transcript from the chat later today. There's several of us from ISS working on the webinar, and I would like to introduce them to you. As I mentioned, Dana Watts will post links in the chat. John Burns is our tech guru. He will be behind the scenes, making sure everything runs smoothly. And Steve Plisinski will be navigating the questions you will be posting during the webinar. On part 1 of this webinar, we will address the questions that were submitted ahead of time, which were chosen after we sorted out the questions by subjects. And we picked up a few from each subject. On part 2, Steve will lead the discussion in efforts to answer some of the questions you posted during the webinar. Unfortunately, Professor Calderon-Margalit will have to leave us to go back to an emergency meeting she just left in order to join us. So she will be the first expert in line to answer questions. Now I will ask the panelists to introduce themselves. Timothy, would you like to start?
Yeah, sure. Hey everybody. Nice to see you, or well, not really see you. Nice to present to you today. Again, my name is Timothy Wu. I'm the Wellbeing Guidance Counselor at Canadian International School in Hong Kong, and I'm also a private counselor at the Southside Family Health Center as a part of the Child Development Team. I'm also a board member of Kelly Support Group, which is a bilingual drug and alcohol prevention and intervention youth non-governmental organization. And yeah, I've been able to have some of my experience in Toronto, Ontario, where I grew up, and now I've had some professional experience here in Hong Kong as well. So hopefully we'll be able to share a little bit of insight for you in terms of what we've been doing in Hong Kong today, and I welcome any questions today.
Ronit, would you mind?
Yeah, thank you. Well, thank you for inviting me, and I apologize for leaving early. And my name is Ronit Calderon-Margalit. I'm a professor of epidemiology. I work in the School of Public Health in Jerusalem, in Hadassah, Hebrew, and I'm happy to be here.
Thank you. Beth? Beth, your microphone is muted.
Good morning. Let's try this again. My name is Beth Younce. I am a licensed school nurse and health services supervisor for Mill River Unified Union School District in Vermont. I've been a nurse for 25 years. And look forward to helping guide you in any way we can. I hope there's some good takeaways from this meeting this morning.
Martin? Thank you, Beth.
Hi everybody, Martin Leach, originally from Scotland, now living and working in Australia. I'm a facility management consultant and specialise in occupational health and safety, so hopefully we'll be able to address some of those issues that you might have in relation to that. I've done a lot of work in the public and private sector, and both in the sort of public, private education and international school networks as well. So thanks again to ISS for the invitation to come along this evening and have a chat with you.
Thank you. So we'll start with the first question because we've got lots of questions and we want to cover as many as we can. So we'll start with Ronit. You have been heavily involved in recommending the Israeli government on the steps to go back to business. What was the approach in regard to schools? If you can share with us.
So originally, Israel, as many other countries, they closed schools on the premises that COVID-19 should act similarly to influenza, where children are kind of the super spreaders of disease, and they also are highly affected by influenza. However, we, as a group of public health professionals from the Hebrew University, we kind of tried to defy that assumption, and we started looking around and looking into literature review and also to situations in other countries. And our main conclusion was that children, especially young children aged 1 to 9 years old, they are not affected as much as older children, especially older adults, and they probably also do not infect others. They do not spread the disease as much as adults. So we were also lucky to have Denmark open kindergartens, preschools, and lower primary school grades, and to see that it did not really affect the disease. You do not see like an increase in morbidity in Denmark. Currently in Israel, well, so our recommendations were to open, especially to those aged 1 to 9, for two main reasons. One is the health and well-being of the children that are currently locked in their houses, and they are probably, A, they do not get education, and B, they might be exposed either to undernutrition and or to perhaps a kind of some sorts of violence could affect them. And we have evidence that domestic violence has increased during the lockdown. And the other reason was that parents to children that this young cannot really go back to work, and that thus it affects the economy in a major pattern, and especially mothers, especially women are the most affected financially from this situation. So our recommendation was that children would go back to school, but in a gradual and very cautious way. And originally it started that way, like our classes are usually very crowded in Israel because we have such high fertility rate and they do not build schools as they should. So originally classes were divided into two, and they would do it in alternate ways, and the intermissions, the class breaks would be in a way that was divided, and we felt pretty safe with that. However, due to political situation, and I guess that's right for many countries now, the decision was now to open the whole system. And in this way, we cannot really promise or be confident that any social distancing is kept. So that's the situation. We're not very happy with that, and we just hope that luck will be on our side.
Okay, thank you. I'll move to the next question. More society around the world are reopening and returning slowly to some type of normality. What are the measures to monitor the situation in order to be effective in responding in case there is another wave of coronavirus?
Yeah, so in most places, there is no kind of usual monitoring of children. I mean, I guess that in all places, parents have to send a daily declaration or something like that, that if a child has fever or any symptoms, he is kept at home. I know that in Germany, at least for the older children, they do weekly tests PCR tests. We don't have that privilege in Israel. We asked the ministry to have tests, at least in schools where we know that there is someone affected, but we do not know if that's taking place yet or not. So our wish is to have some kind of monitoring of surveys, even random surveys of schools, but that's not going to happen in our system.
Okay. Sounds a bit sad, What would you recommend for schools if coronavirus was found within its wider community, meaning that someone in a student family got infected, not the student himself, rather a family member? What actions, if at all, the school should take? Keep the school open, close immediately? Any action related to that you would recommend?
Yeah, so basically a child that in his family there is an active case, a corona case, is usually he himself is getting isolated. So he would stay at home with his family and be isolated from school. But having his classmates, that's a second circle of disease, and that's not really necessary as far as we know. So I wouldn't say that's mandatory. Usually what we recommended is, and also they started with that approach, is having some kind of capsules that, that a child has the same children that he meets every time and the same teachers. And then if one of them gets sick, then you isolate only that small capsule and you don't have to close the whole school, but only to isolate these people alone. And this way, in a way, you can allow having a normal school year that will affect as few as possible people.
Any of the panelists would like to ask Ronit a question?
Yes, Ronit. A number of questions have come in asking about the guidelines for returning a student or an employee back to the school.
So usually someone who has been sick, is that a question? Or
yes, that's right. Someone who has been sick, and now what are the guidelines for assuring that person comes back safely?
So practically, what we do in Israel is we have two consecutive. Someone has to have two consecutive tests that are negative, PCR tests that are negative. I think in a way, maybe reassure people that the current state of knowledge is that people are infective for about a week. And thus, even when they are still positive in their PCR tests, more than a week later, they are probably not infective. But I mean, to be on the safe side, we say, okay, we wait until we have two negative tests in order for someone to get back to his normal daily activities.
So if I could just follow up on that, really, we do need testing versus someone not showing symptoms anymore.
Yeah.
Asymptomatic is not enough to bring someone back to school or the workplace.
Currently, to the best of our knowledge, we don't have enough information yet on the infectivity of asymptomatic people. But so the current recommendation is not to count on the symptoms, but rather on the tests.
And the last quick one, do you recommend students and faculty employees wear gloves?
No.
Okay. Yeah, we've heard that as well last week, that the body has some natural defense mechanisms. Just keep your hands washed.
So I believe, that it's not really feasible, and also it's not environmentally friendly to use gloves. I mean, we kind of destroy our environment enough as it is. So I would say that even for SARS, for example, SARS, the previous corona epidemic, it was shown that washing the hands with soap 10 times a day, they took this number, but it's just, let's say as frequent as you can, was very effective in reducing transmission. And so I would say that having the hands, so children when they come, they should sanitize their hands when they go to the bathroom, before and after eating, before and after having class breaks, they should sanitize their hands. And I think that that should be more than enough.
Okay, Ronit, we'll let you go to your important meeting, and thank you very, very much for joining us and taking the time to
thank you very
let our audience
much.
know. Thank you.
Thank you, and
Bye-bye.
good luck to all of us. Bye.
Thank you. We'll move to Tim. So Tim, your school, the Canadian International School of Hong Kong, reopened last Monday. Could you take us through the support strategies you provided to staff and students before and after the first day?
Yeah, sure. Okay, so I mean, we've been off for about 16 weeks and counting now. And so I think starting with understanding a little bit about students. For students, we've done our check-ins with, you know, the high flyers, as we call them. But also in a school with a well-resourced guidance team with about 10 different guidance counselors across the entire school, from lower school and upper school. Every student is essentially covered as they have their assigned counselors. With that said, we have noted that academic performance that is unlike them as a symptom of how they're doing, or consistent absence from online learning as an indication of needing support. Teachers have been crucial to helping us identify these students. So asking for regular Google forms to be filled out that identify who these students are have really helped us guide our work throughout this time of online learning. So a lot of coordination with admin, a lot of communication between between our colleagues and teachers, just to have a better understanding of where students currently are, given that we're all working from home or learning from home. So as for staff, there's a lot of intentionality among us to divvy up the different staff in the school, from lower school all the way up to upper school as well. So among us 10 counselors, we've kind of picked and choose like different teachers that we were more familiar with, whether it be, hey, just thinking about you and emailing them or calling them, to offering Zoom conversations just to see what their experience has been like. You know, we had check-ins and did our best to ensure that everyone was covered, and you know, we just were very mindful that given their caregiving role and the consistent frontline nature of the role, it was important to make sure that they're cared for. And we also just understood that their roles were rapidly changing so much that there was so much to consider, whether that be working from home with small children, having to put in a lot of overtime with changing up previously planned lessons, or being isolated or alone in a city, or being new to the city as a whole, having family overseas to worry about. You can see how this list kind of goes on and on and on for each individual person. So it was really cool, actually. So as a school, they took the opportunity to put an employee assistance program in place, and we outsourced to a psychological health clinic providing outside psychological support, because we felt it was important to recognize the duality in our relationships, that, you know, being their colleagues and peers, we're not really their therapists. So further normalizing any mental health stigmas that may exist and encouraging reaching outward for support. You know, the same thing with, if you have physical ailments, we're not going to treat them in the school, but we're going to refer them out as well if it's a serious matter, right? Nearing the return to school, we've sent out a teacher well-being survey where it's confidential for the guidance team to see how we can support them or redirect them for more support, and also to better understand if their ability to be in a caregiving role had changed. We need to act in the best interest of students. So understanding where teachers are at, and knowing that perhaps they would, some might want a support like a substitute teacher to help them with facilitating the student sessions as we move forward, was important information for us to know. So now returning back to school, teachers actually returned on Monday, which is really cool. It's nice to see everybody face to face, socially distanced, of course, with masks as well. We've implemented a few strategies following the PREPARE framework. The PREPARE curriculum has been developed by the National Association of School Psychologists, related to school crisis prevention and response. It's really been ideal for us as a school, committed to improve and strengthen our school safety and crisis management plans and emergency response. Given what we've experienced thus far in Hong Kong in the school year as it relates to Hong Kong protests, and now this pandemic, it's been really helpful with regards to approaching crisis or emergency situations in similar manners to create a structured approach and consistency across the board for both students and staff. We had been consulting 2 psychologists, special shout out to Dr. Stephen Brocken and Dr. Melissa Holland for guiding us throughout this process. And I feel this is really important to highlight. Utilizing the professional expertise that is within your school, but also not being afraid to consult with outside professionals to give you another perspective to consider. We understand that in crisis, we really rely on the whole community to respond mindfully to it. So knowing that teachers are recognized as caregivers in the lives of students, we've utilized them as a way of disseminating information and also being our front line to help refer students who may be unknown to us as those who need support. So this is done by asking teachers to present a prepared script that we as the guidance team have put together to help address all students on their first days back, which is actually tomorrow. So we recognize that evidently if they come back to school and just start school as is, there's going to be this massive elephant in the room, given how we've all been off for about 4 weeks now. It cannot go unaddressed. So the script brings students through the facts of the situation, reaffirms their safety, and acknowledges and validates their feelings, and also gives them a chance for questions. And as for how we delivered this to teachers, it's similar in nature, but we address how we're using them as a way to help us reach our students. So the prepare model really utilizes a framework that sets out to do the following. So for one, we share facts. This is important because it gives us all a baseline to operate from. We all have the same information. It also ensures that we are dispelling any misinformation that is out there. It creates the foundation for ensuring that we are finding credible information from appropriate sources, but also highlights if we're too involved or checking the news too much, so much that it creates much more anxiety than it does relieve us. Secondly, it reaffirms safety. We are all experiencing this crisis differently, and that's okay. We shouldn't be assuming that everyone's experience is the same. And this is especially evident when it comes to where we are in the world as well, and where your family may be. This assures staff of what the school has done to protect and bring their health and safety as a priority, and also helps staff understand what actions and precautions have been put in place. If it's not enough for them, this is when we're able to introduce what personal actions they can put into place to help them feel like there's more of a sense of control and predictability according to their circumstances. So I'll give you an example of this is like the water fountains in the school. We have water dispensers and we have water fountains that are used by students. So the school, as an action or as a precaution, closed all the water fountains that utilize a mouth to kind of drink from, right? As opposed to the water bottle filling stations. So for some, that action might be enough. For others, that might not be enough. So personal actions they can take include bringing water from home, or maybe utilizing a sanitizing something to kind of help clean the spout before you fill in your own water bottle. For teachers as well, this also helps us monitor student reactions. Essentially, I would say that this script that we're reading out to teachers, that we're reading to students done by the teachers, is considered a tier 1 intervention, where this kind of presentation is, enough for some students. It also introduces what other supports or resources that may be available to them, like reminding them that their guidance counselors are available to them on a whole. And it actually asks the teachers to help us identify those that may need more support as they go through the script as well. And ultimately, we're striving to create a sense of normalcy and routine. Although this has been quite unprecedented, we also want to be able to support students by being able to emphasize what is unchanged to help them with this transition from being at home to now being in a setting that was previously discouraged to contribute to the efforts of flattening the curve, right? I would say for the stress and anxiety that is often experienced with this pandemic and crisis in general, it's often associated with a sense of chaos and having no control. And what we want to be able to do is highlight how different actions that have been taken and how they themselves can take personal actions, creating a perception of control in this situation, thereby de-escalating how the potential of anxiety or stress they may be experiencing. Lastly, the fun thing in all of this is that we are celebrating their return. We want to acknowledge how excited we are to have them come back to school, as well as students. So we were thankful for the school community that has really strived to help celebrate everyone's hard work. So tomorrow, everyone's walking with loud music, balloons, teachers, socially distanced clapping. And so it's going to be super exciting. So we're really looking forward to tomorrow.
Good luck. Sounds like
thanks.
Yeah.
Yeah.
Thank you very much. That was very extensive protocol that you put together there. And
you're welcome.
Maybe you can share it with us, with everybody. Is it possible?
Yeah, I would really encourage you to look up the Prepare, just the whole Prepare model. I think it's really important that, you know, we were trained in it specifically to help deliver it. And so it is quite important that you can go through it as opposed to taking bits and pieces. Otherwise, it does become not as helpful as it could be.
Okay, great. Thank you very much. We'll move to Beth now. Hi, Beth.
Good morning.
I'll start with the first question. What are some of the things to consider in reopening your school clinic?
Great, thank you. You know, some things to consider before opening your health clinic is really the mindset of what your health clinic is going to be. Are you going to be reactive? And really, you have to start thinking that the health clinic, your school is now become an extension of the health clinic, because we are working with a disease that is outside of just the health clinic. So we really need to kind of think bigger as far as taking health precautions and being safe in school. And so your health clinic is kind of extended outside of the doors of where your health office would be. As far as your mindset in developing your health office, you really need to kind of come at it of, are you going to be reactive to the coronavirus, or are you going to be proactive? You know, are you going to be reactive and kind of have a sit and wait approach until you have a diagnosis in your school? Are you going to keep your same protocols as before, or are you going to start being proactive and start thinking more under the assumption that the coronavirus will be present in your school? And so you need to kind of work out from there. We need to work under the assumption that everyone is a potential carrier. We do, as we heard earlier, that, you know, what we're learning, our children aren't necessarily the big carriers that they thought they were in the beginning, but we still need to work under that assumption that everybody is potentially a carrier for that. So we need to, with working from a proactive approach, we really need to kind of break it down and say, what do we know about coronavirus, right? We know that it is spread by respiratory droplets. We know that it has a high viral load, so it is very contagious. We know that it enters through the nose, ears, and mouth, both directly and indirectly from touching surfaces. We also know that there's multiple symptoms with coronavirus as well, right? And they cover multiple systems in our body. And so we're going to have to be doing some ongoing monitoring of symptoms of this disease. And what we know is that it's here to stay. It's not going away. What we don't know about coronavirus is when a vaccine is going to be available, and the temporary safeguards that you put into your school, we don't know if that is going to be your new norm, or when we'll feel safe knowing that this is behind us. So taking that into consideration, your overall focus really needs to be with your school, not just your health clinic. Prevention of the spread, which means if we're protecting us from respiratory droplets, we're wearing masks. That includes staff and students. Social distancing at all times within the school. Minimizing the movement within the school. And to piggyback what was said earlier, is that if we're minimizing our movements in the school, then we are able to trace back any known diagnosis of a student or staff that has coronavirus. We need to increase our hand hygiene throughout the school. That can be done kind of with the thought of a train the trainer type of approach. So you know, kind of work from a model. Maybe it's a video that you're presenting to your staff, and then your staff goes on to work with the students on proper hand washing and the frequency of when the hand washing will occur. Very important with that. I think it's very important also that you're monitoring symptoms daily with your staff and students, and start thinking about, you need to restructure your health accommodations to accommodate both your general population as well as any potential coronavirus cases.
Okay, quite extensive.
Yeah,
a lot of things to think about and many things unknown.
so many.
what policies and protocols will change in the health clinic?
Right. So there will have to be changes in your health practice. I think it's very important to develop a team with your health professional, with your administration, with staff that can monitor your guidelines that come from your authoritative bodies, from the CDC or from WHO, as well as a staff member that speaks the local language for any other local government health authorities, so that can work as a team, because what we know about this virus is it's a moving target. And so things are always in development and changing. And so you really need to be on top of that and have your organization have a team that can work with that. You also need to develop, based on those guidelines, some protocols for your health staff and for your administration, based on best practices with guidelines that you have. I believe that something was shared this morning, link, and I believe it was from Australia. Is that right?
Yeah, it was from the Department of Education in Australia. It's yeah.
And so it's, first aid, infection prevention, and control procedure that is shared with you. That you
share it on the chat and then upload it to the website. Yeah.
Thank you. I think it's also important that we need to look at our health clinic as two different areas, and they might be different areas of the buildings. You might need to be creative. Last week, I think that there was an area for isolation students that was being used in the gym for a school. You need to start thinking about having a clean area where your general population will be coming in for triage. That's where your medication distribution will be. That's where any health screenings are going to take place. And then any students that are symptomatic need to really be isolated into a different area. Isolation is a strong term. I think that, you know, calling it something different like the waiting room or, you know, the holding room, something that doesn't sound so scary is important, but that needs to be viewed as more of your area where your staff and students are going to be kind of triaged if they are presenting with any signs and symptoms of illness. Again, you need to take into consideration that the symptoms for coronavirus are so varied, from GI symptoms to loss of sense of smell to dizziness to, you know, possibly having a fever. We are seeing that loss of sense of smell is definitely more prevalent in cases than had originally been seen. I think they're asking those questions more. And so you really need to anticipate that more students will be sent home for further evaluation from their physicians. So you need to anticipate that there will be more students absent due to a possible diagnosis of coronavirus, or also the possibility that they have been in contact with somebody and they do need to self-isolate.
Okay. We have time for another question. What do the school health staff need to do to protect themselves?
Good question. Again, it goes back to our basics that we know about the coronavirus. It's spread by respiratory droplets. It enters through the nose, mouth, and eyes, and we can transmit it from our hands. So frequent hand washing is imperative. I also think as far as protective equipment, face shields, masks, gloves, when you're working with students, gowns, if you're going into your isolation room, I think that you need to protect yourself by wearing face shields, masks, goggles, gowns, disposable gowns, booties even. If you are seeing, if you're in an area that has a lot of cases known, you know, the possibility that it's in your population of school is very likely. So you really need to take it from a proactive approach of trying to contain and trying to not spread the virus and work out from there.
We actually have time for another one.
Okay.
So I'll ask you another question. Any different additional supplies that the health clinic should have available?
Sure. Well, so, you know, we should be monitoring for temperatures. However, you know, depending on what you read, maybe only 50% of people are presenting with fevers, but that is something that you should be doing. We know that the no-touch thermometers, the oral scanners, or the thermal scanners, they don't really give us an accurate reading like an oral thermometer or a temporal artery thermometer. So really having a accurate thermometer that you can take temperatures with to really, if you have guidelines in your schools when you're excluding your students, you really need to have an accurate picture of what their temperature is. So I would say that you definitely need reliable thermometers, oral or temporal artery thermometers in your health office. You should have one for the clean office as well as for the isolation room.
Great, thank you very much, Beth.
My pleasure.
We'll move to our next panelist, Martin. Martin, many schools are now figuring out their health and safety policies and procedures in light of COVID-19. In what ways schools can maintain an effective and efficient OHS system that will provide schools with the ability to immediately respond to such events in the future?
Yeah, excellent question, Yael. I think the trick there is to be on the front foot, and to pick up on what Beth was saying, I think we need to be as proactive as we possibly can. And I think there are a few ways that we can actually do that in schools. I think the first thing is that we need to have a system within which there's active participation through Occupational Health and Safety Committee, and ensuring that that has a relevant composition, if you like, from academic staff to admin staff to the students and potentially even the parents. So that committee there is to enable the development and implementation of strategies to look after occupational health and safety in schools. It's also important that that Occupational Health and Safety Committee actually is operating under a fully endorsed occupational health and safety policy, and that they have access to appropriate funding and budgets, not only just for day-to-day operations, but for potential emergency unforeseen situations that may arise. So that's really the first thing. I think the second thing that's really important is a structured risk management system, where it may, within the occupational health and safety area, may well fit into a much broader school risk management and risk register type thing. So the risk management system, I think, really should feature a couple of things. One is regular auditing across the school to make sure that any of those health related initiatives are being implemented properly and maintained properly. And that could even reach to the way that some aspects of the school is laid out, some aspects of how it's designed, some of the materials that are being used around the school as well. I think that could be quite relevant in terms of how easy or otherwise they are to be, how easy or otherwise they can be cleaned. I mentioned risk register. I think that's really, really important, and that becomes a very important strategic and operational management tool, because what it will allow the occupational health and safety managers to do is identify potential risks, and that that could extend to things like pandemics or even local epidemics, as well as the sort of normal facilities related risks that they need to be looking after. So identifying those risks and then assessing what these risks, the extent of those risks, and then finally looking at the controls, so that if something does happen, then there is a process for addressing those risks as quickly and as efficiently as they possibly can. I think following on from that, it's also really important to have effective incident management. So again, if something happens, being able to respond to incidents and accidents as they're happening, to track and identify the number of incidents, because with that information, then again, we can feed that into the risk register and take and have input into our control mechanisms as we move forward. That incident management system will also help to assess the response effectiveness. So going back to the risk register, there'll be responses that would address specific issues that might arise. What we need to do is use that, implement a process where we can learn from that and make sure that any lessons that we can learn from a previous incident are implemented so that we can minimize any issues that might arise from that. And then finally, I think it's also really important to have written procedures that can be adjusted in the light of new circumstances. Procedures that's going to involve relevant people, making sure that those individuals are fully aware of what their responsibilities are in the event of an incident or something happening. So, you know, that in effect is the essence of a rounded occupational health and safety system. Clearly, there's a lot more to it than that. But I think those four sort of fundamental aspects are really important to make sure that schools are going to be on the front foot, not just in the current situation, but also potentially for anything else that might happen in the future.
Yeah. Mm-hmm. I'm sure you can talk about it another hour and
I could, yeah.
Yeah. What we'll do now is I'll say a few things. I mean, with sorting the questions, we realized that thank you, Martin, forgot to thank you, sorry. Sorting the questions, we realized that many of you wanted to hear how to cope with social distancing measures, safety issues, opening school scenarios, etc. As we all know, each school is different and operates in a completely different environment with different level of resources. What I'll do is I'll quickly list some strategies that have been shared to help provide some options on how to go about your school reopening. While I'm not sure if Dana already posted all the stuff, but we've got things that we collected, additional information that you should check after the, also on the chat, but afterwards on the website to download because they're relevant. It is important to be compliant with local laws, regulation and guidelines, and be in accordance with the authoritative sources like CDC, WHO, maybe assign to employees to monitor these guidelines daily and report to your school safety manager or head of school, depending on the protocols in your school. Be sure to check your school policies to see if they match the current situation and amend them accordingly. Limit campus access to only essential personnel. Check temperature, wear masks, and maintain hygiene. Install hand wash stations. I mean, some of the things are already said, but I'll just repeat them. Provide hand sanitizing stations if you don't have ones. Make sure signage is very clear, including floor signs for the right social distancing measure. For example, in the cafeteria, how far in between people you should, how far from each other you should stand in line for food. As for social distancing, to accommodate all students at all times will likely require financial investment that not all schools can afford. So consider to open slowly in well-defined stages to abide with the social distancing. Based on CDC, WHO, calculate the number of people that can be accommodated in each area. An example for well-defined stages could be stage 1, provide only online learning. Stage 2, online learning with teachers teaching from their familiar classrooms. That gives a little bit of more warm feeling, I guess, to the experience. Stage 3, students only in school for specialist class, for example, art, music, drama, PE, etc., while heavy content subjects can be taught online. Another option is third or half-size classes attended school. Students come to school every second or third day. Provide online learning on campus using classrooms and large spaces such as gym, cafeteria, and library, while teachers meet with individuals or small groups of students at a time. There was a question about orientation at the beginning of the school year and how to conduct it if not all students and teachers are there. Again, there are technological solutions to broadcast events. Look them up. A few people asked about the cafeteria. Last week we learned that food itself is an unlike nest of, for viruses. However, utensils and dishes may. So you might consider requiring students to bring their own plates and utensils. In addition, make sure that high standards of hygiene is carried out in the kitchen and with those who serve the food. There's always the option to hold on cafeteria services for a while and see how the community adjusts. This is just one less stress to deal with. So I think those are the recommendations. And with that, maybe we move to a little bit of questions from the participants, Steve.
Yep, helps if I unmute first. So, you know, the vast majority of questions that come through are how to do the impossible questions. And so it really comes down to a risk management, a risk mitigation strategy. Sure, it's safer if you have one child on the school bus, one child in the classroom, everybody wears masks and face shields and has their hand in a sanitizer bath all day long. So think of this as Beth suggests, assume everyone has the virus, is carrying the virus, and then what level of risk are you and your school families willing to take? From a health perspective, and next week we'll talk about from a legal and liability perspective. So a few of the questions, several of them had to do with Beth, particularly with a triage station. Do you, at the gate to the school, do you check everyone's temperature? Do you make sure they wash their hands at the gate? Do you require pre-testing, testing before students are allowed to come back to school? What's the latest thinking on that?
Thank you. Thanks, Steve. It's a tough question, right? Because it is a moving target. And so again, I stress the importance of having a team within your administration to be monitoring for that. Right now, guidelines aren't suggesting for us that students and the whole population is tested prior to entering school. A few months from now, that will change, as we know that things are always changing on a daily basis, it seems like. It would be smart for peace of mind for not just staff, students, and families to do testing prior to entering the building. That can be taking thermometers and just doing a quick survey of if the students and staff have been around anybody that's had coronavirus, or if they have any of the symptoms, the loss of taste, loss of smell, and loss of the ability to taste. If they have fever, chills, shortness of breath, coughing, it might be smart to develop kind of a template that everybody that is checking students prior to entering are asking these questions. And if someone is answering yes to any of those questions, they probably should go to the health clinic for further evaluation. But we also have to be knowledgeable and know that we're not going to get accurate temperature readings from outside. There are so many external factors. If the students are standing out in the cold for a prolonged period of time, their temperature might be, significantly lower than what we normally are, as well as if your students are outside running around at recess prior to entering the building, their body temperature might be a little more elevated. So I think that it needs further evaluation from your health professionals in the building. But that is one layer that could help prevent someone from entering the building that potentially is positive with coronavirus.
One of the questions there, thank you, Beth. One of the other questions came up is whether children should be sent to a clinic if they manifest symptoms. And one of the things that we caution schools on is to have policies in place ahead of time that determine whether you send children to a clinic or whether you send them to parents. Certainly my recommendation is that parents are the responsible ones for determining what doctor, what clinic, what should happen to their child, how they should be managed medically. But this should be decided in advance in your school policies and have parental permission for that ahead of time. Tim, one of the questioners asked whether you would mind sending or posting the faculty employee wellness survey that you have.
Oh, yeah, I mean, I'd be happy to share something to that effect. I mean, definitely there are a number of resources that you can find that, you know, for example, with ISCA, the International School Counselors Association has a number of resources that can kind of address things like that. And so we've adapted it actually from a number of different areas. I'll be happy to share that with you, but I think what I'd like to do first is actually for us to kind of deliver it to our staff this week first. That's just in terms of how we'd like to help our staff in terms of moving forward. Yeah.
Well, thank you, Timothy. Knowing the way that Dana works and seeing her face now, she has octopus hands. I'm sure she just identified the ISTA website and is going to post it for us. Am I right, Dana? Yeah, that's what I thought. Martin, would you mind addressing how, what your thoughts are on training and monitoring the school support staff to the various jobs that they have to perform to make sure things are clean and sanitized in accordance with the guidelines that are produced? Talk a little bit about the personnel management of the operations and support staff in the school.
Yeah, I think one of the key things that we can do there is there's a thing in occupational health and safety called Toolbox Meetings. And I think one of the things that can be done is at the start of every day, the support service staff supervisors can have a very short meeting. And I think that, you know, that would have a multitude of different purposes. Initially, just to get a bit of an update on the status of the school in relation to any health issues that are going on, but also to have a consideration of the sort of tasks that are going to be undertaken that day. Are they relevant? And you know, are there any conflicts between those tasks and anything else that's going on in the school? Ensuring that tasks are scheduled so that the support staff are not working on top of each other. You know, making sure basically that all the staff have got the proper PPE. So there's a whole host of things there, I think, that can be done on a day-to-day basis to make sure that the operational staff they're kept safe, but also making sure that all the users in the school, whether they're academic staff, students, parents, etc., are kept equally as safe, or any risk is minimized as much as possible.
Martin, as you know, in many of our schools don't actually provide adequate break space or snack space, or places to deposit their belongings and so on when working. They end up finding spaces, whether it's under stairwells or in electrical closets or under the bleachers. And I'm all speaking from real experiences. Maybe this is something as well that we can encourage our schools to do, is provide appropriate space and close off those nooks and crannies.
Absolutely. I mean, it's something I've seen, as you know, in the 2 or 3 schools that I've been round to, where that's the biggest issue in terms of trip hazards and all sorts of stuff. But yes, certainly, you know, storage, proper storage of school bags, etc., at break times. But you know, I think it's also then thinking about, and you know, this kind of crosses over with some of the other initiatives in terms of, you know, scheduling and phasing various activities and things like that. So, you know, I don't think the support staff in a school can work in isolation. They're very much part of that broader management team within the school, and everybody's really got to work together to make all this work.
Thank you, Martin. Timothy, there was a question about what do you do with employees that don't want to return to school because they feel unsafe? You talk a little bit about how we can help address their mental health and and be empathetic and encouraging?
Sure. I mean, ultimately, like, I think what we have to remember and understand is that this experience will be different for everybody. You know, we have to consider the fact that, you know, there's a potential of, there are some that may have lost family members. There are those who don't believe in social distancing. There are those who, you know, really believe in the use of masks and gloves, and, you know, so everybody's experience is different. Everyone's opinion is different too. And so ultimately we have to know that we can't assume things about others. I would say that ultimately we need to validate their needs. We need to validate their experience, and we just need to help them understand that we're there for them as a support. Referring them outwards to, you know, a healthcare team or to be a part of the communities. You know, I would suggest that this would be an important aspect to consider as a school of how you would make that available to your teachers. Ultimately, we're talking about healthcare, right? You know, and also we need to understand that for us as their colleagues, we are not their therapists. So being compassionate to their needs is so important, but we also have to be able to be there with them with the understanding that we're not here to fix them. So I think that it's just really about understanding that we want to encourage their and understand that, you know, their experience is validated, I would say. Yeah.
Thank you, Timothy. It looks like we're getting close to the closing of the hour. Yael, do you want to take this back now?
Yes, thank you, Steve. We got to the end of this webinar. I want to quickly thank our panelists for their time, effort, and expert advice, and also thank my colleagues who help every week, actually, to bring this webinar live and work tirelessly behind the scenes. I want to remind you all that the link for this webinar will be sent to participants and posted on the ISS website and YouTube, along with the transcript from the chat. We look forward to engaging you again next week in our 4th school operation webinar, Back to School, Legal Liabilities and Risk Management. A registration email will be sent to you in a day or so. See you soon, and stay safe and healthy. Bye-bye, and thank you.